All right, good evening, everyone, and welcome to the fourth of our NF1 forums in 2020. We are very excited for everyone to join us this evening. We actually have over 400 people registered for this event. My name is Kate. I'm a nurse and I work with the Foundation in Patient Support, and along with my coworker Trace-Ann, we have worked with a fabulous team to put this evening together for you. Tonight we'll be focusing on the impact of NF on relationships, learning, and school, a topic that I know is important to many people in this community, and we're very excited for the speakers that we have for you to hear from tonight. I want to take just a moment and go through just some housekeeping for everybody. This is going to be recorded first, so please just be mindful of that. Please mute yourself at all times. Anyone who is here tonight and joining us, there will not be opportunities to do the raising hand and speak function. We are really excited for you to submit your questions through the chat feature, so please feel free to do that. But we, for sake of time and making sure we have enough time to get all of this great information to you, we do ask that you remain muted for the evening. There are also additional resources about everything you'll hear tonight on our website, and we encourage you to check out ctf.org for that. If you need closed captioning, it is available tonight. You just need to click on that CC button should be the bottom of your screen, and that is there for anyone who needs it. A big thank you to some of our sponsors for the evening, to AstraZeneca, NYU, Memorial Sloan Kettering, and Cornell, who have all played an important role in making this event happen. And also just an extra big thank you that this is our final NF1 forum of 2020. We've had to make a significant pivot away from our normal live event to this world of virtual events, and we could not have done it without the help of this incredible team. Many of these individuals work at NYU Langone Health. We also have representatives from Sloan Kettering and Cornell, and they've been just a fabulous team devoted to putting together a really wonderful program for all of us. And so big thank you to them tonight. Now I'm going to be turning things over to get our evening started. Oh, quickly, just so everybody is aware, there is a feature in Zoom, it's called annotation or annotate. If you do that on your screen, everybody sees it. So please do not use that feature tonight because it will be a little disruptive to everybody. So thank you in advance for that. And now I'm going to hand things over to Celia Engelson from NYU.
Good evening. My name is Celia Engelson, and I am the nurse practitioner and clinic coordinator at the Comprehensive NF Center at NYU Langone, welcoming you to the fourth of 4 webinars for patients with neurofibromatosis. My co-host is Carol Wynn Mitchell, registered nurse and clinic coordinator at the NF Center at NYU. Tonight's topic is the impact of NF on relationships, learning, and school, with a focus on the NF1 population, given that learning issues, anxiety, and social difficulties can be fairly prevalent among patients with NF1, but certainly can affect those with other diagnoses. We wanted to create a presentation for families and individuals affected by NF to clarify the way NF may impact education, socialization, and coping. Psychological and behavioral issues, such as anxiety and attention deficit disorder, among others, are well described among those with NF. NF1 patients in particular can present with cognitive impairment, academic difficulties, and impaired social skills. While our presenters tonight will gear content toward children with NF, these issues can be impactful throughout the lifespan. Therefore, it's important to recognize and intervene for these concerns early to ensure adequate evaluations and supports. This presentation will clarify the services you may need and how best to access them. Among tonight's presenters is a neuropsychologist, a pediatric psychologist, a primary school teacher, a school psychologist, an education coordinator, and we'll also have a presentation by Julina Cece of CTF. Our first presenter is Sarah Powell, a neuropsychologist at NYU, who will explain the importance of neuropsychological evaluation, what such an evaluation entails, and the referrals that might be generated following such an evaluation. Kelsey Largent, a pediatric psychologist, will speak about anxiety and NF, the impact that COVID has had from an anxiety perspective, and strategies for coping. Kim Hansen, a primary school teacher who, along with her daughter, has NF1, will discuss their own experiences and briefly touch on strategies for educational success. Jennifer Shapiro, a school psychologist, will discuss her role, how to request evaluations for your child, and determining appropriate services for children with disabilities. Julia Gomez is our education coordinator at NYU. She will discuss her role, various supports offered within the school system, and how to access what you need. Julie Nassisi is a senior management development of youth programs at Children's Tumor Foundation. We'll talk about a wonderful program called Classrooms That Care. Here are my references in case you want to explore these issues further. Tonight, you can ask questions throughout the webinar using the chat function in Zoom, and there will be 2 to 3 minutes for questions following each presentation. A reminder to keep devices on mute, video turned off, and to avoid modifying any content presented during the webinar. We hope to end promptly at 8:30 p.m. Eastern Standard Time. If you have any questions and would like to reach out after tonight's presentation, feel free to contact me or Carol. Thank you for joining us, and let's get started with tonight's webinar.
Hi, everyone. It's time for our first presenter, Sarah Powell.
Hi, everyone. I'm here to talk to you about the role of neuropsychology and neurofibromatosis. So, who am I? My name is Sarah Powell. I am the clinical neuropsychologist at the Stephen D. Hassenfeld Children's Center for Cancer and Blood Disorders, and I'm a clinical assistant professor within the Department of Child and Adolescent Psychiatry at NYU School of Med. I did my fellowship at the Child Study Center at NYU, and I was faculty there for some time before moving over here. I also engage in some research endeavors over at our pediatric diabetes clinic. So what is neuropsychology? It is a specialty field in psychology that deals with how the brain and central nervous system impact cognition and behavior. So we're really interested in how the brain impacts what we do and how we learn. So typically we figure this out by using paper and pencil tasks. So I always say I'm not the doctor that's going to stick you with a needle or kind of hit you with any of the reflex things we have going. I use paper and pencil tasks to help understand how you think and how you learn, and how we can then apply that information to your functioning in the real world. So we look at thinking and reasoning skills, how you learn, your memory, your language, how your handwriting, your attention, anxiety, mood, all of those other things, as well as some academic concerns. So why is neuropsychology important in neurofibromatosis? So children and adults with NF are likely to have some sort of either weakness or challenge associated with some aspect of learning as a result of their NF1 diagnosis. And so what we try to do as neuropsychologists is identify these weaknesses or challenges early on so that we can help remediate them or build supports around a young child so that there is the minimal impact or as minimal impact as possible. And so that is really what I get to do in the neurofibromatosis community. And so then we make recommendations, and those recommendations can look like therapy, medication, additional services in the school, and making sure that there's special education support. And this is more for parents, but what to do if you think your child is struggling. And often, it's hard for parents and teachers to really identify when a child is struggling sometimes, because that can look like a ton of different things. But some really clear identifiers are grades that are slipping or are a change from where the child used to be, forgetfulness, trouble completing work independently, poor attention, and sometimes with many of our kids, these challenges will become exacerbated over the course of the elementary years. So early on, everything might be going really well, and then you might see some things that emerge around the third grade year that's pretty typical, and that's around the time that school becomes more challenging. Their kids are expected to work more independently, so this is a time that I definitely would take a closer look. And when these challenges do arise, there's a couple things you can do. I would let your doctor who follows you for neurofibromatosis know that you're having these challenges. They will know where to direct you and how to get in touch with somebody like myself. You could speak to your child's teacher and just ask them what they're seeing. Say, I noticed some slipping grades, or I've noticed my child is having more difficulty completing homework. Like, what are you seeing in the classroom? So that the teacher often has really good insight into what's going on all day with the kid, because kids spend 70% of their time in the context of a learning environment. So whoever sees them during that time usually has a pretty good pulse on what's going on. It's also okay when children become a certain age to ask them candidly and say, this is a little bit of a change. Like, is anything becoming more difficult? What's hard for you at school? What do you like about school? What's easy for you? The more you open that conversation, the more children will be willing to then come back and have that conversation should anything arise later on. And eventually, if things are becoming really challenging and we're not really sure what's going on, that's when you would be sent to somebody like me. So I always put this slide up when I give a presentation like this. A psychoeducational evaluation, what you see on the left, is what is done in the context of a school. So a psychoeducational evaluation is done by somebody called a school psychologist, in conjunction sometimes with an educational or learning specialist, depending on where you live. And these are the areas that they target in that evaluation. On the right is the neuropsychological evaluation, and we target obviously a bunch more areas, and we can identify better what's going on with your child, especially for the neurofibromatosis community. It's really important that we target all of these areas instead of just the three, because we know that there are weaknesses in some of these other areas that might be impacting and would benefit from some support and addressing these concerns early on so that we can remediate them. Class, but really what we do when I look and evaluate kids is I look at them compared to same aged peers, and that means a national sample across the US of kids that are between 3 months and 1 year within their age cohort. And so the middle, where you see this big hump in the middle, is about nearly 70% of our children will live within this, what we call average or age appropriate, typically developing range. And then what happens is some kids, and actually really all children and adults, have areas of strength and areas of weakness. So areas where they may fall above this bulk of the curve, or areas where they may fall below this bulk of the curve. And that is super normal. But our children with neurofibromatosis have specific areas where their strengths and weaknesses typically lie in compared to other populations. So what tasks will be administered? The tasks, I always like to tell parents, it's not like they come in, because I tell parents, they're with me from 9:30 to 3:30, and it sounds very overwhelming, but honestly, the tasks range from being less than a minute long to about 15 minutes long at maximum. And so there's plenty of breaks, there's plenty of movement. A lot of them are very active tasks, so kids are engaging multiple sensory areas. So they're either listening and doing something with their hands, or they're drawing, or they're talking, and it changes very often. So kids actually enjoy it a little bit better than school, is what they'll say. It's not a day in the park, but it's typically better than school. Additionally, it is a lot of one-on-one attention, where school is can be a lot less than that. So a lot of kids will enjoy that more. But there is really no one-size-fits-all approach, and the neuropsychologist won't always be able to tell you what tasks they're giving, or when the tasks that they're giving, because it's really a changing environment catered directly to your child or adult. There's a million factors that impact what tasks we use, when we administer that task, etc. So I've been hinting at that, there are some common areas that are challenges in our children with NF1, or neurofibromatosis in general. And just these are a couple of areas where we tend to see skills that might be a little bit weaker. So those are in expressive and receptive language, visual spatial skills, attention and organization, and some like fine motor, like handwriting concerns, as well as math, reading, and writing. And so what does a neuropsych eval look like? I think of it in 4 steps. We have an intake. It's an hour. It's with me and the parents. We go over a lot of boring stuff about the development, the pregnancy, and then like kind of walk through development up until today, as well as get a good understanding of what parents are hoping for and what parents want to get out of the evaluation with me. It's so important as a neuropsychologist to answer the referral question, that this is a really important meeting for me. The testing itself, which I already went over, is about 3 to 7 hours depending on the age of the child and the weaknesses identified, and also the referral question, like what the parents want answered. These things can make that number quite variable. We have a feedback. It is 1 hour long. Again, that is just with me and the parents, unless the child is of a specific age. But typically just me and the parents, where we discuss findings and I make a lot of recommendations. I basically give parents a roadmap of where do we go from here? How do we help? How do we remediate this? How do we improve? And how do I support my kid? That's where that all happens. And then you get a full report, which is rendered a couple weeks after you see me. And that's often submitted to the Department of Education or any kind of like social services so that you can get hooked up with resources. And so this is just a review of something that I've already said, but neuropsych evals kind of help us understand the child's capabilities or potential to learn, how the child learns. We can determine the crux of an issue behind a learning struggle. So for example, I always say, like, a kid's grades might be slipping, but it might not be that the difficulty is in reading itself. They may not be attending, or they may have trouble with writing. Like, there may be a million reasons why we're seeing an area of weakness, and it's my job to figure out why. And that's what a neuropsych eval can help with. So, and then again, I give recommendations for evidence-based intervention that match the child's difficulty so we can produce the most optimal outcome and remediate some of these skills that may be weaker, and how to utilize the child's strength to overcome weaknesses and again, create some academic or occupational success that is important to parents or child or whomever. And then I also work with schools, albeit a little less so. We have an educational coordinator who does a great job with that where I work, and you'll be hearing from her as well if you haven't already. But developing an educational program that is appropriate for the child. And I also really have found over the years clinically that when children themselves understand their weaknesses, they become better advocates for themselves, and then they actually do better in school and in life because they know how to play up their strengths. And so that's really all I have for you today. So thank you for bearing with me, and I'm so glad I was able to present today. Have a nice night, everybody.
Hi, I'm Carol Mitchell, and I am going to help fill some of these questions that have come through. One of them is, when is the right time to seek evaluations? Is there a time that's too soon? Is a child too young, maybe?
I think that really depends on the child. I would say if the child's not experiencing any delays, if the pediatrician doesn't, for example, say like, I'm worried about speech or language, motor skills coming along, I wouldn't necessarily subject any specific child to an eval early. I think it's a lot of work for them and it can be tiring. But as soon as we see something, I think it's okay to ask for an evaluation. I typically work with about 3.5 and up, but there are plenty of neuropsychologists or early developmental psychologists who will work with kids even younger than that. And there are plenty of resources available for the younger population too. So, but the second you start to see something that's more challenging for them, or the second you see a difference, I think that's a good time.
Thank you. How about what do I do with an evaluation once I've received it as a parent?
Sure. So this can be a little bit of a misconception. The document rendered by a neuropsychologist is a medical record. So it is yours for the keeping. That said, many of our parents will choose to submit that document to the Department of Education. In New York City, I know that we submit them to either the district level or the school level, to the director of special education at that school. But really, anybody within the school should be able to direct you to who that evaluation should go to in order to get that IEP process started, if that is what was recommended. I also find that social services later on, if you require any disability services from the government, sometimes this report will also be submitted there. So, but it is yours because it is part of your medical record.
Thank you, Sarah. We're gonna move on now to Kelsey Largan. Kelsey is our pediatric psychologist here at NYU Langone, and we will start her presentation now.
Hi, I'm Dr. Kelsey Largan, and I'm a psychologist at the Stephen D. Hassenfeld Center for Cancer and Blood Disorders. I know that many of us have been struggling with a lot of anxiety and stress this year, so I wanted to provide some information on coping during the ongoing coronavirus, with a focus on how patients with NF can cope with anxiety, both during the pandemic and beyond. Children and adults with NF are at increased risk for social and emotional difficulties, with 15% of adults with NF reporting symptoms of anxiety. Consequently, psychosocial support is a critical component of care for this population. During a time when anxiety is heightened for all of us, it is important that patients with NF are able to identify and cope with symptoms of anxiety. Since the corona outbreak in March, we have all experienced a lot of changes in the ways that we are living, working, and going to school. Many patients and families have a lot of questions about the pandemic, many of which don't have any answers, as well as intense feelings that are difficult to cope with. For example, many patients and families are worried that they might get the virus. They are coping with a lot of uncertainty regarding how long we will have to wear masks or social distance, and they are having to adapt to new ways of working or going to school that may be challenging. Patients and families have also shared a range of emotions that they are experiencing, including anxiety and worry, sadness or depression, and feeling disconnected from their families, friends, and communities. First and foremost, it's important to note that all of these thoughts, feelings, and reactions are normal. You are not alone in these concerns, and your experience is valid. But how do you ride the wave of uncertainty and get through this time maintaining your own well-being? In order to answer that question, we need to start out by identifying one of the most common reactions to this epidemic, which is anxiety. Anxiety is our body's natural alarm system. Usually that alarm is helpful and protects us from danger. For example, it prevents us from touching a hot stove or running out into a busy street. It can also motivate us to study for an upcoming test or prepare for a big presentation at work. The problem is that sometimes our alarms are overactive and go off even when there isn't an immediate danger, which causes us to always be on high alert. When that alarm goes off, your body responds automatically. For example, your thoughts start racing to evaluate the threat quickly and make rapid decisions. Your heart tends to beat faster. You may feel dizzy or lightheaded. Your breathing becomes quicker, your palms get sweaty, and your muscles get tense. All of these changes help us to react to danger in our environment, but it can take a toll if you are experiencing these reactions on a regular basis. Ongoing chronic stress is dangerous because it can cause or exacerbate many serious health problems, including mental health problems such as anxiety and depression, cardiovascular disease, digestive problems, sleep problems, weight gain, and issues with memory and concentration. So it's really important to address anxiety when it happens, rather than hoping that it will go away or get better with time. So how do you cope with ongoing stress and worry? You ride the wave of uncertainty. Riding the wave of uncertainty is when you acknowledge what you are feeling without getting sucked underneath the current. There are a lot of emotions we are going through right now that we need to recognize in order to ride the wave of uncertainty, and one of them is grief. We are experiencing grief for a lot of different reasons. The world has changed dramatically since the beginning of this year, and even though we know it's temporary, it doesn't feel that way. We are grieving the loss of normalcy, the fear of the economic toll, not just for ourselves, but for our country, and the loss of connection. We're also feeling anticipatory grief. Anticipatory grief is that feeling we get about what the future holds when we're uncertain. We feel it when someone gets a serious diagnosis or when we think about losing one of our parents someday. Anticipatory grief can also be more broad. There is something bad out there that we know is coming and we are grieving that loss. With a virus, this kind of grief is so confusing for people. Our primitive mind knows something bad is happening, but you can't see it. This breaks our sense of safety. Across the country and the world, we are feeling a loss of safety and we are grieving that loss both individually and as a society. To address grief, it may help to understand all of the stages of grief. It's important to note, though, that the stages aren't linear and they may not happen in order, but can provide some structure to help you through the process. There's denial, which we say a lot of early on. This virus won't affect us. There's anger. You're making me stay home and taking away my activities. There's bargaining. Okay, if I social distance for 2 weeks, everything will be better, right? There's sadness. I don't know when this will end. And finally, there's acceptance. This is happening. I have to figure out how to proceed. Acceptance is where the power lies. We can find control in acceptance. I can wash my hands. I can keep a safe distance. I can learn how to work virtually. The first thing you can do to start to address feelings of grief and anxiety is to change your routine. Being at home is throwing us all off. We aren't going to sleep or waking up at the same time. We are eating food that may not be the healthiest, and we are spending a lot of time watching TV or doing other solitary activities rather than interacting with others. If you can get back to a routine, even if it looks very different from your routine pre-coronavirus, you can start to feel more like yourself. Try meal planning at the start of the week so you can make sure that you are including more healthy meals that everyone can enjoy. Pick a regular time to go to bed and wake up in the morning and stick to it. Studies show that people that are able to do this have better sleep overall. Try to stay away from the news if you can and make sure that it is a reliable source. You may want to choose a time of day to check the news and then avoid turning on the TV or reading news articles the rest of the day. Finally, try to schedule times to connect with friends and family virtually. It really makes a difference seeing someone's face rather than just hearing their voice, and can help you to feel more connected to your support system. The next step is to work on changing your thinking. Start by recognizing when you're having a distressing thought or image, then stop for a moment and ask yourself, is this thought helping me or hurting me? For example, you might be having thoughts that someone you love is going to get very sick and you're imagining them in the hospital. Your natural instinct may be to ignore these thoughts or try to force them to go away, but your mind won't let you do that. When you are thinking the worst, you have to help your brain by replacing those thoughts and images with more helpful ones. For example, parents might think, just because there are a lot of cases in the country does not mean my child will get sick. I am doing everything that I can to keep my child safe, and my doctors and nurses are taking steps to make sure that my child stays healthy while getting treatment. When you are working on changing your thinking, it isn't about putting on a happy face and pretending everything is okay. It's about inviting in more positive thoughts to weigh in against the negative ones, so you're able to have a more balanced view of whatever it is that you are thinking about. Be compassionate. Everyone will have different levels of fear and grief, and it manifests in different ways. You may notice someone you love getting frustrated more easily and acting in ways that don't seem consistent with who that person normally is. Remind yourself that everyone is feeling scared and try to give them some time and space to process their own feelings. Search for meaning, even when things seem hopeless. People are using FaceTime and Zoom and Google Hangouts to call friends and family from all over the country, some of whom they haven't talked to in weeks or months because they were so busy. They are spending more time with their families and coming up with delicious meals to cook at home. They are going on walks and exploring their own neighborhoods. Many of us are already finding the positives in a very difficult situation, and I believe that we will continue to do so in the weeks and months to come. What if you are still feeling overwhelmed? Keep trying. You will not feel better overnight, and you may still have days that feel really hard. But when you recognize your feelings, you can notice them and let them move through you rather than getting stuck in an emotion. Sometimes we feel the pressure from society not to feel a certain way, and so we tell ourselves how we should be feeling rather than noticing how we are actually feeling. It's important to just stop at the first feeling and try not to judge it. If you feel sad, take 5 minutes to feel sad, whether or not other people think you should feel that way. Fighting your feelings doesn't help because your body is producing the feelings. If we allow the feeling to happen, we can acknowledge it and move forward. I'd like to end our session with a list of helpful resources. The first is the NYC Well Hotline, which is a crisis center that operates 24 hours a day, 7 days a week, and is staffed with mental health professionals that provide free behavioral health assessments, intervention, and support. You can also text this hotline by texting WELL to 65173. There's also a teen-specific hotline that you can contact. One of the things that has been helpful for my overall health and well-being is to continue to exercise during quarantine. On the right, I list some companies that are offering free online workouts. The next resource is a video that has tips with coping with the coronavirus that I found to be helpful. You should be able to access the video by clicking on the link provided. Finally, on the right-hand side of this slide is a list of stress reduction apps, some of which are offering free content. Mindfulness and relaxation are some of the most effective tools for managing anxiety and stress, so I'd highly recommend you to download one of these apps to see if it is helpful for you. I wanted to take a moment to acknowledge 2 resources that I pulled from to create this presentation. The first is an article that was in the Harvard Business Review entitled "The Discomfort You're Feeling is Grief" by Scott Baranato. And the second is a video put out by Montefiore Medical Center entitled "Anxiety and COVID-19 Video." Thank you so much for listening. I hope this information was helpful.
Well, hi, actually, there were not any questions that came up on that one. Although one had come in earlier from the email I had sent out. And it's a question that says, my 17-year-old son has always related well with adults and has trouble, and to children, adults and children, but has not related well to peers, and was wondering if there is something that can be advised for that.
Sure. So whenever a parent comes and says that their child is having difficulty relating to peers, just like anything else, that could be due to a ton of various things. There could be a number of reasons for that. I would say if it's a stark change in the way that they have been, I would feel comfortable talking to them about it. If it's something that's kind of always been present, I would definitely ask a teacher. Teachers have a great pulse on not only the learning needs of the classroom, but also how your children are interacting every single day. So they're great resources, and asking about specific behaviors or specific emotions that are being seen in the classroom can be really, really helpful. And then you could bring that information to your provider. You're on mute, Carol.
Right.
Oh, you're back on mute.
And now I'm not muted. I was just going to ask if any of the questions had come up in the chat for this topic. Was there anything we could ask from the group that was screening questions?
There's one just now, Carol, that says,
Thanks, Trace-Ann.
why does anxiety get worse at puberty?
It's a really good question. A lot of things are happening at the time of puberty. And again, this is multifactorial, right? So one thing that's happening is your child's own hormones are changing, which can produce a lot of different reactions, and one of them being a change in social emotional functioning. Another one is that everybody around your child is also changing, and that can produce a ton of different new types of interactions between people. And so we do see some sort of hormonal driven differences in how kids are functioning emotionally. But it's also a time when things get more complicated just in from a dynamics perspective at school. So there's a lot more to navigate from a social perspective around that time of puberty too. So things could be a reaction to that. I would definitely go to your doctor if something seems different.
Thank you.
Yeah.
So I think we're going to move on to our next speaker, and we will be listening to Kim Hansen. Kim Hansen is a primary school teacher on Long Island, and she is going to start speaking soon. Thank you.
Hi, everyone. My name is Kim Hansen, and this is my daughter, Katie Hansen. I am very honored to be here with you today to talk to you not only about my personal experience with NF, but also with my professional experience as well as a teacher. We started our journey with NF when Katie was 2.5 years old. She was playing with some toys in the family room, and I noticed that her eyes crossed. After taking her to the pediatrician, because I thought that was a little strange for a 2.5-year-old to have happen, we were referred to an ophthalmologist who, after a couple of different tests, determined that she had a brain tumor. We went for an MRI, and the MRI showed that there was an optic glioma that was growing pretty rapidly, and we needed to be seen by an oncologist at an NF clinic. We were sent to NYU at the Hassenfeld Children's Clinic, where we received amazing care, and Katie underwent chemotherapy for over a year for the optic glioma, and she did very well with it, and she's been actually doing very well since our little journey through chemotherapy. When she was going through everything and I started doing a little research on what NF was all about, I basically started to connect a lot of my youth and a lot of symptoms with myself. And after seeing a geneticist, it was determined that I also had NF. I was diagnosed at 38 years old. And so, as we all know, NF doesn't have any particular size or shape. It's a little different for everybody. But the one thing that it has affected us pretty much with the vision loss is Katie's education. I've been an educator for over 26 years in primary education. I've taught pre-K, I've taught kindergarten, I've taught first grade, I've taught second grade. And I know that as a parent, it can be very scary and intimidating when your child needs help. So I thought it would be helpful if we took a moment just to have some ideas and some tips of things that we can do to help our child get the best education that they can and the most help that they can. So I'm going to share my screen with you so that you can see. Okay, let me just play from the start. Thanks for your patience. So I thought it would be helpful if I spoke to you a little bit about the keys to a successful home and school connection. So let's talk about some things to know. Research has shown that when there is a strong supportive partnership between home and school, a student's work habits, attitude about school, and grades definitely improve. I'm going to talk to you a little bit about a few things to think about since school is just starting, and you may have concerns and you may have worry. So here are some things to think about. It's always important to meet with your child's teacher as soon as you have a concern. If you have concerns right before school starts, send your teacher an email. Just say that I'd like to touch base with you. I mean, it's difficult now to determine whether or not a teacher can actually see you in person because of everything that's going on, but it is helpful to talk to your teacher right away. Remember, you know your child better than anyone else knows your child. And if you can be as specific as possible with their strengths and their weaknesses and what they're afraid of and what they like and what they dislike, it's only going to help your child's teacher learn about your child and also to help them guide them through their learning. Your teacher may make suggestions to you of things that you can try at home and things that you can do at home to help your child. Be open-minded. As much as you know your child and you love your child and you want what's best for them, some of us that have been teaching for a really long time have lots of great ideas of things that have worked in the past with other students that may be similar to your child. Don't be afraid to be honest with your child's teacher. If your child, has NF and you're intimidated about sharing that information with your child's teacher, there's so many great places that your child's teacher can look through and see, especially on the Children's Tumor Foundation website. There's brochures they have made for educators that I always gave all of Katie's teachers. Follow through with the recommendations that they made and make sure that you take that time to really listen to them and the suggestions that they make. Even if there are things you don't think will work, give it a try because you might be surprised and things may work really well. When you're done with that first initial meeting, it's always important to make sure you talk to your child's teacher about how you'll continue your communication. Because remember, you shouldn't really stick with just one meeting with your child's teacher. You should be meeting with them throughout the school year. You can ask them, what's the best way can I reach you? Would you like to follow up with a phone call? Would you like to have a communication notebook so you can talk back and forth with your child's teacher, about how your child is progressing? There's also lots of support staff in your building that can be available to you, even more than your child's teacher. So I wanted to talk to you about some additional support staff. Your child's social worker is such an important part of your child's education, especially if they have difficulty with their behavior, with social skills. The social worker is a person that really can provide support and guidance to all of the students in the school. It may have to do with individual or group counseling. They can provide crisis intervention, and they can also give you some resources as to people that you can reach out to outside of the school building to help your child. The social worker is really the key person to use in the elementary school, and while they are also in the secondary schools, the school counselor that's there is the person to really talk to. They have a very similar job to the social worker, but they're a little bit more geared towards the academic goals and overall. I know it can be intimidating, and I know it can be scary. I know with Katie, when she was 3.5 years old, we went through early intervention. She had every service that was available to us. I knew as her mom and as also as a teacher that I had those places to reach out to. Don't be afraid to reach out for help, because we're all in this together, and the stronger our community connection is with each other, the more successful your child will be. Like I said, communication is key, and it will only help you with everything that you do. This is my information, my email address. If you ever have questions or concerns that you want to talk to me about. Like I said, I've been a teacher for 26 years, and I've seen so many different children. And the one thing that I know more than anything else is the strongest connection with the parents that I have had. Those children have had success in their future. I wish you all well and health, and I'm always available if you have questions. I hope you have a wonderful evening, and I know that you're going to have a great school year. Have a great night, everyone.
Thank you, Kim. I have some questions for you. One of the questions came in is that now that we're remote and not having contact with other students, how can I encourage my child who is naturally more introverted to connect better with his peers?
That's a great question. Both of my children are currently learning remotely. I have a 17-year-old. I'm giving him many more years to his life. A 15-year-old son named Kevin, and I have my daughter Katie, who is turning 13 in March. They are both learning remotely right now, while the rest of our school district is 100% fully in school. So this was a situation that came up in our home. I am also teaching fully remote in the district that I'm teaching in this year. And a couple of suggestions that I found were pretty helpful is to try to have your child reach out to some of the other children that are also working remotely from home. Katie has a group of 3 girls that are all learning remotely from home. And during lunch every day, they have a Zoom lunch together. And, it started out, the first week of school was a little hard to coordinate, but they decided maybe once a week they would meet during the lunch period and have lunch together and talk about how their school day went. That's just one way that could help. And also, just reaching out to those other kids that are in the same situation, form study groups with them. Zoom and Google Meets has been such a great, valuable tool for all of us as teachers, but also to keep us connected during this time.
Thank you. I'm just going to stop for a minute and just give the mic to Annette Bacher, the president of CTF.
I just wanted to make a quick comment. And first of all, Kim, I really wanted to thank you for your contribution. This is absolutely amazing and I think very helpful for our community. And I think tonight, I just wanted to remind everybody that we're really here together for you, the patients and the parents. And I really wanted to thank all those people that have put an enormous effort in making tonight a success. They've given up their free time, they've given up their work time, they've given up a lot to make tonight important. And we know that in the beginning of the call, annotation was possible, but I just wanted to share a little bit of my shock, that I'm shocked that some people are enjoying themselves to write on our screen. It's almost like graffiti, right? I think this is disrespectful to all those people that have shared their time and effort and have put time into tonight. It has been disabled, so the ones that want to have fun, you can stop now because it's not possible anymore. But I really want to shame those people that are polluting our evening that is supposed to be beautiful, united to end NF. And I don't think those people should even stay on tonight. So with that, I want to share my anger and still thank those people for all the beautiful contributions they have tonight. And on behalf of CTF, I really want to thank everybody who's putting the effort in ending NF. Thank you so much. And let the people who pollute tonight leave the call.
Thank you, Annette. That was beautifully put and very, very important message. I'm going to ask Kim another question. Kim, this is an interesting one. What can I do if my child's teacher is unapproachable or doesn't seem supportive?
This does happen sometimes. I've had this experience myself. You know, the one thing you can do, sometimes people feel that they can go to the principal and talk to the principal about it. Your building principal is almost always going to ask you, did you speak to your teacher first? So my recommendation would be, as far as getting the results that you want, would be to reach out to your classroom teacher, even if they're not approachable, find out ways that they are comfortable speaking to you. If that doesn't really fully work, depending upon what your child's needs are, there are other people in the building that can help you. If your child has, you know, situations with their social situations, you can speak to the social worker. If your child is having difficulty with reading, you can ask if the reading teacher can contact you. Reach out to the other staff in the building because that's what they're there for. If all else fails and you've tried every single thing you can try, reach out to your building principal. Express to your building principal, you know, I've spoken to the teacher, I've spoken to the reading teacher, I've spoken to the social worker, and I really still feel like my child needs more help than they're getting, or whatever the situation may be. They're always going to tell you when you go to them, did you speak to your child's teacher, is always what's going to be said first. Just make sure you reach out in all different areas first, and then that should really be your final resort.
Thank you, Kim.
You're welcome.
I have more questions, but maybe if we at the end we can have more time. But just in the effort to get everyone's presentations done, we'll move on. But I'm going to move on now to our Jennifer Shapiro. Jennifer Shapiro is a certified school psychologist working with the New York City Department of Education, and we'll start her presentation momentarily.
Hello, everyone. My name is Jennifer Shapiro, and I'm a New York State certified school psychologist working in the New York City Department of Education for the last 8 years. I have an undergraduate degree from SUNY New Paltz in psychology with a minor in sociology, and then completed my master's plus 30 credential at Queens College prior to working for the New York City Department of Education. Today, I'll be presenting on accessing special education supports for students with neurofibromatosis. The first thing I would like to talk about is how a parent or medical professional initiates the evaluation process in school. So parents or guardians, anyone participating in the child's care, can write a letter to initiate the special education process, known as an initial referral. In the initial referral letter, you'll want to describe the concerns about your child's academic performance, emotional functionings, as well as any concerns with behavior or physical development. In the letter, you're going to write explicitly I am requesting a special education evaluation for my child. This begins the evaluation process. Once you've written the letter or initial referral, you're going to give it to a staff member in your child's school. After writing your referral letter, you will receive a referral packet, which will include a notice of referral letter and an introduction to the special education process, as well as an appointment for a social history interview. The social history interview is an opportunity to explain your perception of your child's functioning across multiple areas, as well as relevant medical history. This appointment can be conducted in any language. At the end of the appointment, you will be asked to sign what we call informed consent. So the social worker, after hearing all your concerns, will inform you of your parental rights as a parent seeking an evaluation and special education services. Once consent is signed, the evaluation process can move forward. It's really important during this appointment to state any specific concerns that you have. For example, if you express concerns with your child's fine motor functioning, it's likely that an occupational therapy evaluation will be recommended. After the social history interview is complete, the school-based evaluation can begin. All initial evaluations include a psychoeducational evaluation, which includes cognitive, academic, and social emotional functioning information, a classroom observation, as well as separate evaluations in any concern area noted during the social history or observed by the psychologist or social worker throughout their own observations. After all the evaluations are complete, you will be contacted to participate in an eligibility meeting to determine whether your child qualifies for an individualized education plan, what's commonly referred to as an IEP, within 60 days. When attending that meeting, it's important to bring any relevant information that may have transpired during the 60 days, such as new doctor's appointment information or any other outside evaluations. And feel free to make a request for an interpreter in writing at least 72 hours before the meeting if you'd like translation services. Now I'm going to talk about what is determined at an IEP eligibility meeting. The first thing that we have to determine is whether students meet the criteria for a disability classification prior to determining what services they may need. So a disability classification is one of 13 classifications outlined by New York State. For students with neurofibromatosis, it's likely that they would be classified under other health impairment or multiple disabilities if the student is also intellectually disabled. Now that we've determined that the student does meet the criteria for the disability classification, the next thing is to determine what academic setting the child will learn best in, any additional services that they may need, and what goals they're going to work towards. I'm going to go into detail about each of these next. So the first thing is an academic placement recommendation. Depending on the level of support each student needs, different levels of academic supports or classroom placements may be recommended. The least restrictive, so the minimum amount of support that a student can receive academically is called, in the Department of Education, we refer to it as SETS, Special Education Teacher Support Services. This is usually a pull-out service for students who require minimal academic support or targeted support in one area. This is sometimes known as AIS or formerly called Resource Room and can be recommended individually or in a group. Level of support is referred to as integrated co-teaching. So this is when a student is placed in a general education class But there are 2 teachers, one licensed in general education and one licensed in special education. And up to 40% of the students in this class may be mandated or have IEPs. The next most supportive setting would be a self-contained class in a community school. This is a small ratio of students to teacher for the maximum level of supports provided in a community school setting. So when we say community school, what we mean is an elementary, middle, or high school that it does not solely contain students with IEPs. So in New York City, this is usually your child's zoned school. If your child needs more support than can be provided in their local community school, they're typically recommended to a specialized school. This includes District 75 within New York City or BOCES in Long Island and Westchester. And these are referred to, like I said, as specialized schools and can have different ratios of support. Now that we have discussed academic placements, we can discuss some of what we call related services recommendations or additional services that children may need support in. One common one is speech-language therapy, which supports students with expressive and receptive language difficulties, articulation concerns, and language fluency concerns. Next is occupational therapy. This supports students with fine motor tasks as well as sensory regulation and adaptive living skills, otherwise referred to as ADLs for activities of daily living. Another service that may be recommended is referred to as physical therapy, which helps students with gross motor weaknesses in the areas of movement control, ambulation, balance, and coordination. Another service is school-based counseling, which helps students support their social and emotional needs. Here are some other services that students may benefit from in school, depending on their needs. Now I'm going to just briefly go over what happens next. So you've had the eligibility meeting, your child has an IEP, you get the IEP paperwork sent home with them, and following up from that, I just want to explain that every year, children have what's called an annual review. This is when you would meet with the teacher, service providers like a speech therapist, to go over the goals and progress that your child has made and developed a new IEP for the upcoming school year. Every 3 years, a student receiving special education has their information reviewed by a psychologist. This is referred to as a 3-year review or a triennial. Lastly, if in between these, at any time, parents or teachers have concerns that the programming or recommendations for the students is not appropriate, they can request a reevaluation. After each of these meetings, annual review, 3-year review, and reevaluation, a new IEP is generated with updated information, service recommendations, and thank you so much for letting me participate today and share my work as a school psychologist with all of you. I look forward to collaborating with any parents that have further questions regarding the special education evaluation process, and you can contact me at jshapiro713@gmail.com. Thank you.
Thank you, Jennifer. I do have some questions that came up during the presentation, and it was an excellent presentation. How can I, as a parent, prepare to attend my child's IEP meeting?
So sorry. So when parents are attending their child's IEP meeting, I know it can be a little scary, but I think that the idea that you want to go in with is, first of all, read all the evaluations beforehand. So those should be sent home to you usually around 5 days prior to the eligibility meeting, so that you have a good idea of what kind of the content of the meeting would be, and just try to go into it with the idea that everyone is there on the same page and everyone is trying to do what's best for the child and recommend the appropriate services. So I think I would just go in and try to collaborate with everyone, but still go in with the idea that you're the expert on your child, you know your child best, and make sure that your consideration and as a parent is part of the meeting.
Yeah. So that leads to the next question, which is, I know you said be the advocate, but how do I ensure that my voice is heard as a parent?
So I think that the idea of the meeting is to come in, like I said, and really all come together and make the decision that is most appropriate for the child. In New York City, we also serve as the CSE chairperson. So we are making the recommendations. And I think it's really just about having like a back and forth and having the staff listen to what the parents are saying, as well as parents listening to what staff is saying, because everyone comes in with their own ideologies. Like sometimes parents will come in and they'll say, I want the maximum amount of support. So I want 3 or 4 times a week speech, OT, PT. And I think it's interesting and helpful to listen to the school staff and try to like come together and build a plan that makes the most sense.
Fair enough. It sounds good. It sounds like a plan, and I hope everyone's listening. We have to advocate for our kids, but we also have to listen to the educators who do this. We're going to move on now to our next presentation. Julia Gomez is our education coordinator here at Hassenfeld, and she is going to start her presentation now.
Hi, I'm Julia Gomez. I'm the education coordinator here at SDH. It's so nice to participate in this webinar. I'm just going to give you a little overview of my role as education coordinator and the ways in which I can help to support families and patients with school-related needs. So first and foremost, I provide educational intakes and consultations for our families. I often get referrals from the medical team or other psychosocial team members when school-related or developmental concerns arise with any of our patients. I meet with the family in clinic or via Zoom or phone consult and complete an intake to assess for any education-related needs. Then I'll make a plan with the family and provide step-by-step guidance and advocacy in order to help our families access the appropriate evaluations or services, make any changes in education planning that the child needs. And I do make myself available to help guide in every step of the way because it can be a confusing process. Of course, I also refer to Sarah if I think a patient would benefit from a neuropsych evaluation, and also to Kelsey as needed for any mental health concerns. So a very large part of this role is advocating on the behalf of the patient, which includes regular communication and intervention with our patients' school teams. Every day I'm speaking with school psychologists, guidance counselors, teachers, principals to address any school-related concerns. Most regularly, I am working to secure services, obtain or amend IEPs, speaking to teachers about different ways to address our children's needs in the classroom. Basically anything that comes up, I'm willing and ready to help with. I also provide a lot of guidance through some of the more confusing DOE processes and aim to help build strong and supportive relationships between the schools and the families, which is so important and benefits the children. More recently, I've been helping our families to navigate this transition to remote learning, which has been extremely challenging for many families, as I'm sure many of you know. I've been involved in every way from helping to secure learning devices, providing supplementary academic support, accessing online portals, helping with tech issues, it goes on. So this is a new challenge for all families and is a bit of a learning curve for everyone, but we are doing what we can to ensure that our kids have what they need in order to be successful in any learning environment. So another critical element of this role and planning for education in general for our families is collaboration with medical teams and with schools, as I mentioned previously, and providing continued care throughout one's academic career. So I'll often check in with the medical team to determine if or when further intervention is needed for any of our patients and refer as appropriate, as I said, to Sarah for neuropsych testing, Kelsey for mental health support, or anywhere else. I also will coordinate and participate with school team members to advocate for an individual's specific needs, provide helpful information to the necessary personnel in school. I'll participate in meetings, review diagnoses with nurses, etc. And we provide the support through many of the tricky transition periods, such as the turning 5, high school applications, planning for after high school, and ongoing into the future. Here we just have a diagram that illustrates an academic intervention pyramid. Tier 1 is showing us the general education population. Tier 2, providing a more targeted learning supports to students using assessments and interventions. And Tier 3 illustrating students that have individually designed learning programs with supports from IEP, accommodations plan, etc. I have a feeling that other members of this panel have reviewed this, so just a quick illustration. In addition to the child's regular school, I work very closely with our DOE partners at the hospital and within home instruction when our patients are unable to attend school. I connect the home and hospital instructors with the child's regular school team and can facilitate consistency in curriculum, help to modify curriculum, modify class requirements, change scheduling, whatever is needed for our patient at that time. Thank you so much for listening and participating in this webinar. If you have any questions for me, this is my contact information. You can feel free to email or call my office line. I am happy to help. Enjoy your evening. Thank you.
Thank you, Julia. Julia is unable to be here with us this evening, although she has sent us her beautiful presentation. But I have a question that has come in, and Kim Hansen is going to field it for me. Is with remote learning, will my child receive their mandated IEP services such as PT, OT, and speech language services?
Yes, they absolutely should continue receiving their services, especially because if their district is working fully remotely, this should be provided for them without any stop in service. You know, the way it is delivered may not be the traditional way it's delivered. Speech therapy may be done this way via a Zoom meeting. It may not be able to be done in person, but it should stop without a hitch and it should continue. Both of I am a teacher. Like I said, I am teaching a remote classroom right now. I have 3 children in my class with IEPs. I've been in touch with their service providers throughout the school year so far. And my daughter, who also has an IEP, she's visually impaired. She has continued to receive her services throughout this entire thing. So it should definitely continue, yes.
Thank you, Cam.
You're welcome.
Thank you. I'm going to move on now to Julie Nassisi. I get to say that now. She's a newlywed. Julie is the Senior Manager in Development of Youth Programs, and she is a member of the Children's Tumor Foundation.
Thank you, Carol. So I'm really excited to be here. Thanks everybody for joining us. I'm going to tell you a little bit about Classrooms That Care and the impact that it has inside the school. So I know things are looking a little bit different with COVID, so I'm going to touch on that as well. But as Carol mentioned, my name is Julie P. Nassisi. and I run the youth programs for the Children's Tumor Foundation. Classrooms That Care is a service learning program that teaches students about neurofibromatosis. They do this through educational activities, programmed to design to fit kind of curricular standards. So we have a STEM program, a STEM mini unit that's adaptable from grade 3 through 12, just as an example. Classrooms That Care also allows participating schools to raise funds for NF, and that of course go all towards research. But not only that, it's also raising NF awareness, and it builds empathy for those that are facing medical and health challenges. And we really are goal to empower students to celebrate diversity and to really embrace inclusion within their communities. I just want to use a little quick example. I have a great network of Long Island schools, and one of the wonderful NF moms that I work with said, hey, I want to bring this into my hero school. I talked to the teacher, they want to do it, what do we do? I said, great, send her my way, and I kind of took it from there, and I worked with, this happened to be a gym teacher that organized this. And they did all these exercises in school, which we're now adapting to be virtual as well. But these exercises allowed students to put themselves in the shoes of somebody living with NF. So for example, a lot of our heroes have fine motor skill issues. So students are asked to tie their shoes, and it's timed, and it takes 7 seconds. And then they are to put on a pair of gloves and then tie their shoes. And it just takes so much longer, and they really start to register like, this is a lot harder than you would think that it is. And it's these little simple exercises that we've kind of incorporated into this program that have really opened the eyes of students, and not just students, but also teachers and faculty. It allowed, after this program, the volunteer came up to me and she said, you know, I just can't believe what an impact this had, because I used to dread going to my IEP meetings or my 504 meetings. And it used to be like fighting tooth and nail to get the services. And now these teachers understand, like, this is maybe why this hero's handwriting is so sloppy. It's not because they're lazy. It's not because they don't care. And their eyes are opened a little bit more about what's going on. And it was a great success. And in fact, until COVID hit, we went from putting it into that one school. We then the following year put it in 2 schools, and then we were going to have it in 5 schools. So this year has definitely been very challenging. And so we understand that schools have been affected by COVID, and that education might look different to many students and teachers this year. So the Children's Tumor Foundation recognizes that need, and we want to continue education in the classroom. So we're actually going to be updating our website to have all of our curriculums and educational materials, which also includes Moxie and Sparks Explain NF videos and comics and some blog posts and a few other great goodies, but a full repertoire of educational resources that can be used in the school or virtually through school. So you can go to Children's Tumor Foundation's website, ctf.org, go to Get Involved and Classrooms That Care. It's not completely updated right now. We're hoping to have it updated by mid-October. But it's a great program, and all of the educational materials have been created by NF moms who also happen to be teachers or social workers. So everything was made to be really easy for schools and really personal and to the community as well. Any questions?
Thanks, Julie. Thanks, Tracy Ann, and thanks all of you for being here today. So I'm here to tell you about a really exciting event that CTF is doing we're doing a hackathon, and CTF has done this before, tied into our NF conference, where it's been in person, and we get a group of NF scientists together for the weekend, and they hack different solutions and come up with cool projects for NF. So this year we went virtual, and I think what's been really exciting about this year's hackathon is because it's virtual, we're actually getting global participation, and we're really able to attract a broader audience. And so the purpose of the hackathon is really to draw, in the spirit of collaboration, as you know, CTF has always been, really getting people outside the NF space to get excited about developing solutions for NF. And so this hackathon is designed not just for NF researchers, and clinicians, which of course we're reaching out to, but also healthcare startups and developers and engineers and hackathon enthusiasts. We're trying to bring everyone together to drive solutions for NF. And we also want you as patients to have the opportunity to get involved, because certainly your perspective will make a huge difference. And so there's going to be 3 tracks, so people can come up with projects within one of 3 tracks. So there's NF data, where they work with data sets to bring solutions forward. And then we have mobile device engagement, where the teams are actually going to create mobile device applications to improve the quality of life for patients, and there's a lot there, which of course would be directly applicable to all of you. And then we also have a wildcard category where people can come up with their own projects and submit them for approval. And so we really want to let you guys know, and I know Tracy Ann's reached out to many of you, that we welcome patient participation either on the teams. There's no fee to register, because there will be people that will want you to be a part of their teams, or you may want to join a team and to have input. And that would be, if you join a team, it would be a 6-week commitment, because the hackathon starts on October 2nd and it goes all the way through till November 13th. And then all of the teams, the projects will be judged for a week, and then the winners will be announced on the 20th. And there will be cash prizes, so we're really excited about that. And then you could also be a mentor. So some teams may just want access for your input as sort of a consultant. And so we have a really cool panel of mentors who will be available to the teams, just sort of on call during the week. And again, it's virtual, so it's really just allowing 2 hours spread out throughout the week, knowing that some of the teams may be reaching out to you for advice. So whichever interests you, we'd love to have you all involved. And so when I'm done speaking, I'll post the link in the chat, so I can give you a link directly to our Hack for NF website. And if you're interested in being a mentor, you just have to email Salvo, and he'll send you an invitation for that. And, we're really excited about this event because we're drawing a huge audience outside the field, as I said, to just come up with some really cool new solutions to advance research, to use our data better, to improve quality of life. So we're very excited. And if you have any questions, let me know. And I know Salvo's available, and I'll post some links in the chat, but it should be and by the way, we have just shy of 200 people signed up already, and people are continuing to register. So we're shooting for 500. We think we'll get close to that, and so more to come. So I don't know if anybody has any questions, or I can put more information in the chat, and feel free to follow up with me at any time, or with Salvo. And if there aren't any questions, I'll turn it over to Kate Keltz.
And before you do, Barbara, while you're at it, we still have 6 minutes. Do you want to just give a shout out to the Shine a Light NF Walks? I know that we're in the season and there are many events planned.
Oh, sure. Yes. So we're really excited about the walk program. So as you know, we took our walks virtual this year. And so each walk has been doing different things on their Facebook pages. So we've had lots of videos and photos posted. We've had honored hero roll calls. It's been really exciting, and different patients. We've had a lot of new teams come and share their stories. So we've raised a lot of money so far. We shout out, for example, our Virginia Walk was just this past weekend. Teresa Williams was our organizer and has already gone well over 10,000 over budget. So congratulations to Teresa. We've had our Seattle Walk, our Iowa Walk, our Bay Area Walk, and our Michigan Walk, and they've all been doing great. And then this weekend we have Jacksonville, and then we have many more to come. So you just have to go to the shinealightwalk.org website. You can actually sign up for any walk anywhere because they're virtual, and we have our great walk team that will work with you. And we're just really encouraging people on the days of the walks to post videos. Our walk staff will work with you if you want to edit them. And there was just a lot of interaction on Facebook, and so we're really excited. And just, yeah, so feel free to join any one of the walks, and we'll work with you to make your fundraising successful.
Wonderful. Thank you so much, Barbara. It was wonderful to hear about some of the other programs that we have, and I hope that everyone is as excited about them as we are here at CTF. I'm an employee of CTF, but I'm actually participating in some of these programs because they are a lot of fun. So I really encourage you to check them out. I want to just take a minute to thank everyone one more time for being here tonight. It has been a really fantastic event. We did not know at the beginning of this summer when we pivoted to a fully virtual program how things would go, what the response from the community would be, but we should never have doubted you guys. This is a fantastic community. We are grateful to be able to work with all of you, and you have shown up in force and been amazing and participating and asking fabulous questions, and it's been wonderful to see. So thank you to all of you for being here tonight. Thank you to our incredible speakers, and one more time a big thanks to NYU and the hard work they put into working with us to put together all of these events. So we're very grateful to them. And I just want to, just a quick reminder, so as a nurse, I worked with CTF specifically in patient support. So if there were conversations that you started tonight in the chat, questions that you asked that weren't addressed, or questions that you thought of but didn't get a chance to ask, please feel free to reach out to me directly. I did put my email in the chat. I'm going to put it in there one more time just so that you can get a hold of me if you have questions. If I don't know the answer, I should be able to connect you to the appropriate resources to get those answers. So, and I love hearing from all of you. So thank you again for being here tonight. We really appreciate it, and we hope everyone has a wonderful rest of their evening. Thank you.